Hi folks, this is Lydia Saad of the Gallup organization. I have been with AAPOR as a member for 26 years and happy to be here today to talk about some COVID-19 data. I want to thank our conference chair, Mandy Shaw, for her introduction and for organizing the session. A particular set of data that we've been collecting on the Gallup panel, which is a probability-based panel, via web. We've been doing this poll daily since March 13th and wrapping it up in some weekly results. Full description of Gallup panel methods is available at that link. So here's a good summary of where we've come with social distancing from middle of March when Americans first started to incorporate these behaviors because of concerns about the pandemic. And you can see the rapid increase in the percentages of Americans saying they are avoiding various forms of public contact. The gray line is avoiding travel, air and mass transit. The dark green line is avoiding public places, including stores and restaurants. And the lighter green line is avoiding small gatherings of friends and family. So all these things started off low, rocketed up to 80% or so adoption of these things by the end of March and have remained quite high, especially through April, come down a bit in May, but we still have majorities of Americans saying they're doing these things. Now, at the same time that we have seen some decline in social distancing, we've seen a corresponding increase in people wearing face masks. So that's just a little counterpoint to point out that lack of social distancing in terms of not interacting with people doesn't necessarily mean people are not being responsible or careful if they're doing it with things like face masks. Will Americans maintain these practices going forward for as long as it takes to be out of this crisis? One question we've asked is, if it's up to you, how soon would you return to your normal day-to-day activities if there were no restrictions and no closures? Given 4 options, only 28% said they would get back to normal right now. And what's interesting about this is this has not increased over the last 4 weeks, even though there has been quite a bit of change in the kinds of businesses open and the infection rates in some states. Obviously, it's increased a lot since March, but it's sort of leveled off around 28%. Meanwhile, these are the other responses you can look at later, but we've still got 30% of Americans saying they're going to wait until there are no new cases, or 13% until a vaccine is developed, or 29% want to see those cases decline significantly. So majority of Americans in these more conservative groups wanting to see less risk of COVID-19 before they go back to normal. Similar finding here, if you're looking for a marker of when Americans would go back, looking for a decline in the percent worried about contracting COVID-19 would be one. We're not seeing that. Constant rates of those very or somewhat worried that they could get the virus. Also constant rates in those saying that the overall coronavirus situation in the US is getting better. Fewer than half have said that consistently. It's improved a little bit since early April, but hasn't gone up any further. We still have a majority, as you can see in the bottom half of the screen, saying the situation's getting worse or staying the same. Here's a trend that has gotten better. It's people's concern, their worry about availability of coronavirus tests and availability of hospital services, supplies, and treatment in their area. But as much as that's come down, we still have close to half of Americans saying they are still very or moderately worried about these aspects of public health surrounding COVID-19. And here is a kind of a nice lump sum question of what Americans think on the overall philosophy of whether we need to keep social distancing or get people back to work. There's still much more on the keep social distancing side. We say, what's the better advice right now for healthy people? 69% say it's to stay home as much as possible to avoid contracting or spreading the virus. 31% say to lead normal lives as much as possible and avoid interruptions to work and business. So still a long way to go before those lines cross. And then finally, what kind of pressure is coming from Americans' own stamina for enduring the emotional stress, the physical stress, and the financial hardship that goes along with social distancing. These gray columns are showing the percentages saying they can endure as long as necessary before encountering these hardships. You add in the dark gray columns saying they can go a few more months. You've got majorities saying they can go quite a bit longer before they personally are going to feel the pain in these areas. So right now, in some, it looks like Americans, they had a rapid uptake in social distancing. It's not going to be a rapid unwinding. They are clinging to these concerns. They are looking for much more significant signals that it's safe to go back to normal. To the extent they are going back to normal, they're wearing face masks, and we'll continue to monitor these trends. Thank you very much and enjoy the rest of the conference.